second question is, of course, you protected yourself with that slide that said, I don't know why it works. But if I am correct, your patients are not obeying the first principle of thermodynamics. Somehow, they are losing weight when they are receiving more calories than necessary.
Yes.
You had one slide showing
Yes.
a patient with 2,600 calories.
Absolutely.
Losing weight when the requirement...
Thermodynamic is very confusing matter. I mean,
confusing.
confusing everybody, even you, Dr. Mario. So, thermodynamic, I don't know even the law of thermodynamic.
Dr. Hussein, you started by saying that in diabetics you don't advise a ketogenic diet. In one of the three precautions, in renal patients, in diabetics.
True, Dr. Nabil. What we do usually, before we start with any patient, we do renal function test. We do urine for microalbumin. And we are sure that serum creatinine, urea level, all we examine prior to start. And of course, plus the history, which myself or my colleagues who are from primary health care, they do along. It's not only my study. I have to mention that a lot of people were really involved in this, more than 8 or 9 persons really. And I don't know, I didn't put, but in any case, all these people, they investigate, and we have got a file system which is going and putting every period of time to follow them again. And whenever there is any chances to increase the problem, immediately we stop. But what we did find that creatinine level and urea does go high within 2 to 4 weeks, and then start, even uric acid, by the way, and then slowly starts coming down, reaching to the normal level.
No, because in diabetics there is no American Diabetic Association recommendation or any recommendation for the ketogenic diet in diabetics. There has been no on evidence-based medicine.
No, what we say, we don't put it as ketogenic diet. Let us say we'll put it low carbohydrate diet. Better than term, I think.
I think now, I mean, the gold standard for providing evidence for any hypothesis is if you have a randomized controlled trial.
Yeah.
I mean, I don't know whether I missed it, but it didn't show us like a study published somewhere else or from here where low carb diet compared to low calories diet, and are the results comparable? The second question is, these improvement in biochemical profiles, is it related to the diet or is it related to lose of weight? I mean, to the reduction in actual weight. For example, improvement in glucose, improvement. So can you?
Yeah. Your first question is really, this study were done, really. I didn't bring it. It was done in 2002 in New England Journal of Medicine, and two papers came. And then they did a randomized trial studies and showed that low carb versus high carbohydrate diet, really, and worked very well. Again, the same thing, biochemical parameters improved really. And apart from that, in JAMA also some paper came, in Annal Internal Medicine, and so many. There are a lot of studies done regarding this trial study. The problem with our work, the people coming here to lose weight, you cannot advise them to go in low-calorie diet so that you compare it with the low carbohydrate diet. And this is the problem which we are facing. And that's the reason when I did a study here, we divided the group between high cholesterol level and normal cholesterol level. Otherwise, I couldn't make anything. I don't have any control groups, really. When we discuss with the nutrition people, they are completely against this idea. They are just saying, no, this is going to kill us. It causes ketosis. It's so silly people, they don't read, unfortunately. And this is the worst thing of them. And this is the problem. Okay, now, coming to your second question, I think the improvement in parameters and biochemical parameters due to reduction of weight. I think if we reduce the weight by 10%, definitely there is, I'm sure Dr. Nabila knows that always, even the diabetologists, they said, oh, decrease your weight. The things become better. It's well known. The diet, it really mimics, it makes you as if you are full because of fat, nothing else. And believe me, even calories-wise, Dr. Mario were talking just now, even calorie-wise, they are taking less than prior to administrating ketogenic diet, because hardly they eat. Once they'll have a high, full protein with fat, they completely, for 24 hours, they are satisfied. They don't feel hungry. So even calorie-wise, now thermodynamic condition, Mario is asking me. Again, I think low-calorie diet, this is one study, but you quoted me on that one, Dr. Mario.
Have you measured actually the daily intake of calories of these patients? Have you measured the daily expenditure of calories in these patients?
No. No.
How can you say?
My condition, I didn't say it. I said, well, this ketogenic diet improves the parameters of the patient. And these people are very happy. They are energetic. They are very energetic. And they are doing good job. It's rather sitting doing nothing. At least I'm doing something. Well,
May I ask a follow-up question?
yeah.
First of all, my problem is I didn't see any control in this stuff you did. Second of all, experimentally, how did you make sure that your subjects were actually on the diet you prescribed for them? Particularly, you did it for 56 weeks. How did you make sure? That's all they have.
Well, questionnaire, we have a questionnaire always, even in